The question that you're raising, sir, is an important one. And there are several things that you need to do. First of all, in terms of your general health, make sure you've stopped smoking if you had started. And there is very good evidence that stopping for at least 15 or 20 years will reduce your risk of lung cancer and several other types of cancer down to the normal population. As far as your prostate screening with PSAs, there's been a lot of controversy recently regarding that. I think the important thing to recognize is that no single test is perfect, and it requires the physician to sit with you, talk to you about any symptoms you might have. You have indicated that you are having no symptoms, but that does not let you off the hook in terms of screening for prostate cancer, especially since in the African American community there is an increased incidence of prostate cancer. If you have a family history of prostate cancer, it is even more important that you start your screening at least age 50. If it's a heavy prostate cancer history, it probably should start even a little earlier than that. And the PSA can be used. It's one of many things that the physician looks at in your overall our overall approach to prostate screening. The digital rectal examination to determine whether or not you have any nodules, any irregularity to the surface of your prostate, that's also very important. The controversy recently involved the overuse of PSA screening and the over-treatment of those patients that were found to have an early prostate cancer. That is a judgment call that the physician has to make and uses the PSA and the digital examination and, if necessary, biopsies of your prostate to determine what the treatment is. It may be that the treatment is just watchful waiting without any surgery, without any radiation therapy, but continued monitoring with PSA and digital examination and possibly biopsies. So I think you can't ignore your prostate health because you have no symptoms. That's extremely important, along with all the other things you need to do to maintain a good, healthy lifestyle.